screen. Tumor markers. Most markers are not suitable for general screening, but some may use in those with a strong family history of a particular cancer. In case of genetic markers, they may be used to help predict risk in family members. The PSA test for prostate cancer is an example. It is help to diagnose in a patient with that has symptoms. Tumor markers has been used to help identify the source of cancer, such as a CA-125 for ovarian cancer, and to help differentiate from other conditions. The tumor markers cannot diagnose cancer themselves, but aid in this process. Stages. If the patient does not have cancer, tumor marker elevation can be used to help determine how far the cancer has spread into the tissue or organ. Determine the prognosis. Some tumor markers can be used to help doctors determine how aggressive a cancer is likely to have. Types of tumor. The important tumor markers are alkaline phosphatase, lactate dehydrogenase, phosphatic acid phosphatase, prostatic specific antigen, human chorionic gonadotropic alpha fetoprotein, chorioembryonic antigen, CA120, CA153, CA125, calcitonin. The alkaline phosphatase elevates primary is secondary liver cancer, secondary bone cancer, lung cancer, cancer of gastrointestinal tract and ovary, Hodgkin's disease. Prostatic acid phosphatase. The prostatic acid phosphatase is produced mainly by prostate gland. It is found in erythrocyte, platelets, leukocyte, bone marrow, liver, spleen, kidney, and intestine. The serum prostatic acid phosphatase level is increased in malignant conditions like cancer of prostate, multiple myeloma, osteogenic sarcoma, and bone metastasis of other cancers. It may be elevated in some benign conditions, such as benign prostatic hypertrophism and or enlarged prostates, or osteoporosis and hyperparathyroidism. Clinical application. It is not sensitive marker for screening for early detection of cancer. It is useful in staging of prostate cancer and cancer therapy. Prostatic antigen, specific antigen PSA. The major site of PSA production is glandular epithelium of prostate. A major function of PSA is proteolytic cleavage of gel forming protein and increase sperm motility. It is used as a marker for prostate cancer. Certain procedure involving prostate gland like transrectal biopsy, tracheotomy, and conditions like prostatitis and acute urinary retention (BPH) and cancer of prostate will cause increased PSA. Clinical application. Early detection of cancer. PSA is specific for prostatic tissue but not for prostatic cancer. PSA level alone will not detect cancer in early stages. PSA level is highest level in BPH. The serum prostate antigen value together with the digital rectal examination, transrectal ultrasonography is used in early detection of prostatic cancer. Early detection is important because the prostatic cancer can detect it in the early stage. Staging of prostatic cancer. The PSA level is found to correlate well with the clinical signs of prostatic cancer. The elevation of PSA level is seen in advanced stage of cancer. Monitoring treatment. The PSA level is useful in monitoring and definitive treatment of prostatic cancer. After the radial prostatotomy or radiation therapy, the PSA level should be decreased or should fall below the detection limit of the assay. High PSA level even after prostate removal indicates the presence of residual tumor. Methods of PSA estimation. Most of them are radio immunoassay method, radio immunoassay, enzyme link immunosorbent assay, fluoroimmunoassay, microparticle enzyme immunoassay, and chemiluminescent assay. Principles of enzyme MEA. PSA plus microparticles coated with a monoclonal antibody against PSA. PSA monoclonal antibody complex. GOAT anti-human PSA ALP conjugate. PSA monoclonal antibody. GOAT anti-human PSA PLA conjugate. Sandwich binding. Substrate 4-methylum phosphate. Fluorescent 4-methylum billiferone. Fluorescent estimated PSA level by MEI as a fluorescent polarization immunoassay principle. The fluorescent The fluorescent polycyclic immunoassay is a typical homogeneous competitive fluorescent immunoassay. Generally, the total assay time is less than 1 minute. Fluorescent immunoassay widely used to detect the drug level of the serum. The principle is based on the increased polarization of fluorescence of a small fluorescent label hapten when bound on a specific antibody. The polarization of a fluorescent antigen conjugate is determined by its state of rotation during the lifetime of excited state in solution. A small rapidly rotating fluorescent antigen conjugate has a low degree of polarization. However, the binding of large antibody molecules shows a slow down the rate of rotation and increases the degree of polarization, and homogeneous assay is possible. Human choriogonadotropin, it is secreted by the trophoblast cell of normal placenta. The physiological HCG appears to maintain the corpus luteum, thereby allowing synthesis of progesterone and estrogen, which supports the endometrium. The placenta hormone HCG is similar to LH, FSH, TSH. All Gs are glycoprotein contains two non-covalently bound dissimilar subunit alpha and beta with the carbohydrate side chain. It increases normally in pregnancy and also trophoblastic disease and germ cell tumor. Clinical application: it is an excellent marker for early confirmation and monitoring of pregnancy, aiding in detection of ectopic pregnancy. HCG is useful in identifying patients with a trophoblastic tumor along with AF alpha fetoprotein. It is useful in the detection of a non-seminiferous tubular tumor where HCG level correlates well with the tumor volume of prognosis. A high level of HCG even in CSF indicates brain metastasis. HCG is used to monitor the therapy of patients with the central nervous system metastasis. Its level is useful in monitoring the treatment and prognosis and the progression of trophoblastic disease during chemotherapy and after remission. The periodic level are measured to detect the relapses. The method of assay: immunometric assay like a radium assay, ELISA, FIA, and specimen with the serum normally less than 5 molar international molar unit per ml. CA 115.3, CA 25.29, CA 70.24. Preliminary tumor breast cancer. Additional association: malignancy, colon, gastric, hepatitis, lung, pancreatic, ovarian, and prostatic cancers. Benign conditions: breast, liver, kidney disorders, and ovarian cyst. Normal value 38 units per ml. Lower level above which begins in less than 100 units per ml. Sensitivity: elevation is about 33% of early stage breast cancer and about 67 of late stage of breast cancer. CA 1919. The primary tuberculosis, pancreatic, and biliary tract cancer. The additional associated malignancy in which level exceeds or colon, esophageal, hepatic cancer. Benign conditions: pancreatitis, biliary disease, and cirrhosis. Normal value 37 units per ml. Level above which benign is more than 1000 units per ml. Sensitivity: elevation in 80 to 90% of pancreatic cancer and 60 to 70% of biliary tract cancer. Cancer antigen 125, CA 125. The CA 125 is a glycoprotein normally expressed in coelomic epithelium during the fetal development. This epithelium lines the body cavity and envelops the ovary. Normal value is 35 unit per ml. Primary tumor with ovarian cancer. Additional association malignancy: endometrial, fallopian tube, breast, lungs, esophageal, gastric, hepatic, and pancreatic cancer. Benign condition: menstruation, pregnancy, fibroblast, ovarian cyst, pelvic inflammation, cirrhosis, pleural, pericardial effusion, endometrium. Level above which benign less than 200 units per ml. Sensitivity: elevated in about 85% of ovarian cancer. Elevation in only 50% of early stage of ovarian cancer. Calcitonin, thyroid, medullary carcinoma. Normal range 0.155 nanogram per ml for men, 0.105 nanogram per ml for women. on-co-fetal antigen are protein produced by during the fetal life. These proteins are present in high concentration in the serum of a fetus and decreases to low level of or disappears after birth. These proteins appears in cancer patients. The production of these proteins demonstrates that the certain genes are reactive as the result of malignant transformation of the cells. There are several examples of oncofetal antigen: the oncofetal protein CEA, beta oncofetal antigen, and pancreatic oncofetal antigen. Alpha fetal protein. The alpha fetal protein is the best example of oncofetal antigen. It is a marker of hepatocellular and germ cell carcinoma. Clinical applications for detecting fetuses with a neural tube defect, screening of hepatocellular carcinoma, prognosis and monitoring of therapy of patient. Methods of assay of immunometric assay like FIA, radiation ELISA, normal level 0 to 15 nanogram per ml. Carcinoembryonic antigen. It is a marker for colorectal cancer, gastrointestinal cancer, lung cancer, breast cancer. Uh, clinical application. It is elevated in the benign condition like cirrhosis, pulmonary emphysema, rectal polyps, benign breast disease, and ulcerative colitis. It is also increased in colorectal, lungs, gastric, breast, pancreatic, ovarian, uterine cancers. Moreover, the CEA is not marker in these cases because the elevation associated with the benign disease of a number of tumors that do not produce CEA. The CEA is used as an adjuvant in clinical staging. If CEA increases 5 to times than the normal, it may be colon cancer or may be associated with other cancers. If 28% increases than the normal, it may be colorectal cancer of stage A. If it is 45% or more, it is a colorectal cancer of stage B. In the prognosis of development of metastasis, monitoring the therapy of colorectal cancer, monitoring breast, lungs, gastric, and pancreatic carcinomas, monitoring the metastatic colon cancer. Method of immunoassays like radioimmunoassay, FIA, ELISA, normal 0 to 4 nanogram per ml. For smokers, 0 to 5 nanogram per ml. Immunoglobulins. இது